evening, good evening, good evening. This is Community Voices TV with the Minority Report. Of course, we are discussing the coronavirus pandemic as it affects our community. And I'm your host, Dr. Aubrey Orrin Lewis, and this is our May 3rd report. Now, before I begin, let me just say a happy May Day weekend to all of the workers. Whether you're labeled as essential or not, you're workers. We have to have solidarity. And let's hope that we have a new paradigm, one of solidarity with each other going forward from this. All right, rather than the rugged individualism. Tonight we'll be discussing the statistics in brief, and more importantly, the Black community response to this pandemic. Let's look at some of the statistics. Roughly speaking, we have about 33,000 confirmed cases in Suffolk, 35,000 in Nassau, and 167 in New York City. Nationwide, we have 304,000. The total tests as of the 29th of April, 95,000 in Nassau, 93,000 in Suffolk, New York City, 400,000, New York State, 900,000 tests. Now, how do you interpret these results? They're political, and they do not mean anything. They're just enough of a fig leaf for the politicians to cover you know what. But other than that, they are just fig leaf covers. Okay? Even the CDC said that these statistics are higher. And what they're doing is conveniently just counting this is deliberate, just counting the people who die in the hospital under medical conditions, but not the people who die in their homes. Okay? Now, in spite of the fact that the Black community is taking the brunt of this pandemic, you never hear that from the governor. The rock star never mentions the fact that the blacks are suffering significantly. Okay? It was not until the public advocate Jemani Williams mentioned this fact that the governor came up with a lame excuse and proceeded to go back to his pandemic briefings, useless as they are, with the wonderful charts provided by his buddy from Northwell, Mikey Dowling. He provided those wonderful charts. Okay? Of course, the governor is never surrounded by black folk. And he's shown from his actions that he does not care about black and brown communities. Because it was the governor who closed the community hospitals serving these communities and gave the carcass over to his friend Mikey Dowling at Northwell in order to make a profit for the cabal. Okay? So that's the governor. Right? Now, I'm also puzzled as to the response of the black community to this crisis. Okay? It seems to be absent. I don't know if maybe it's just me. Because from early January, Black residents were complaining of mild to moderate upper respiratory symptoms that were attributable to seasonable or the unseasonable weather or to mild cases of influenza. In the first week of March, a 42-year-old male employee of the Mercy Medical Center was confirmed to have tested positive for COVID 19. The man was a resident of Uniondale. No one knows how much contact he had with the Uniondale School District. A lame statement was published in Newsday from the superintendent, William Lloyd, saying that they were in contact with the local health department. This is incompetence and a careless act, and it left the school district with 7,000 children exposed to the virus as it spread in the community. This is deeply disturbing that the superintendent and district depended on the health department not known for their scientific rigor for advice in protecting our children. The other school districts in the white community shut down their operations out of an abundance of caution without even having one case, much less being an epicenter. This was the first official case in Nassau County, New York, and it occurred predictably in the black community in Uniondale. What followed to the casual observer from Mars must have appeared as a circus of inaction and incompetence by the school district, the Nassau County Health Department, and the Nassau County Executive. Immediately after that first case, a cluster of 15 other cases were noted, probably from the same family. Thereafter, predictably, Uniondale, then Hempstead, became epicenters for the coronavirus pandemic. This released a pandemic of incompetence, inactivity, and uncaring leadership. Uniondale and Hempstead became uncharacteristically silent as their so-called leaders looked to the county executive for help that was predictably not forthcoming. On any given day, Uniondale and Hempstead are bustling with political and civic groups plying their trade and fighting for the little influence and power permitted by the establishment. But during this crisis, these groups have been silent as the two communities have been ravaged by the pandemic. One wonders if these groups have become victims of the cleansing action of the pandemic. As the pandemic took hold in Uniondale and Hempstead, it unleashed some bizarre responses from the health department and county executive that raises some moral, legal, political, and ethical questions. Nothing was being done about the crisis, and this raises the existential question, why? Why were these communities of predominantly black residents the county executive depends on to be elected not being served? But then again, they don't pick up the garbage, or we get very, very poor government services in these communities. So I'm not surprised. Although the first coronavirus case was found in the first week of March and might have been associated with the Uniondale School District, the superintendent did not close the schools. Again, that's a Mr. Lloyd. Neither did the health department or the county executive. This incompetence and inactivity gave the virus, again, ample time to spread, and the results support this. It was not until March 18th that the governor closed the schools, finally. This was a sign of things to come. Meanwhile, school districts in predominantly white communities were closing. Okay? In the badly stricken communities of Uniondale and Hempstead, no public health disaster plan was unfolding to help these communities because the health department and the county executive had no such plan. The governor and the state had no plan either to prevent this pandemic that they knew was coming. To be surprised is no excuse. It's to acknowledge incompetence and malpractice when everyone knew. The only plan is what the governor's medical arm, Northwell, came up with. Now the governor, with his health czar Michael Dowling standing next to him, unleashed a long enemies list to be blamed for his failure to prevent and protect New York. The list includes President Trump, the CDC, NIH, China, WHO, the World Health Organization, the coronavirus, the rest of the world, blacks, immigrants, etc. It is said that blame is a coward's way of deflecting accountability and responsibility for personal actions. Ladies, I leave that for you to interpret. What a profile of incompetence and greed. The governor refuses to acknowledge his errors and support for the profit-making machine he and Dowling created called North Hill. In this regard, he has taken a page out of Trump's book on leadership and accountability. The language used is interesting to fight this. A war, the enemy, social distancing. Ladies and gentlemen, social distancing is not a concept. It suggests that, distal emotional relationships in a country already struggling with domestic violence, racism, racial violence. That's what social distancing means, and that's what it brings. Okay? The true word, phrase they should be looking for, is physical distancing, not social distancing. In America, we're always fighting and losing wars. Wars on poverty, wars on drug, war against communism, war against socialism, war against abortion, war and violence are in America's DNA. War against black folk, war against Spanish. We're always fighting and losing wars. The coronavirus, by many estimates, have been circulating in these communities since October. And let me tell you, ladies and gentlemen, in that time, nothing has been done. We have had no significant testing of the residents, no screening, no quarantine, no quarantine, no contact tracing, no mitigation, no information, no education, no risk management, no prevention, mental health programs, social health programs, programs to deal with unemployment, programs to get food and essential supplies, programs to occupy the children, no educational programs, no programs for the sick, no assistance for the elderly. And this is an incomplete list of the failures in Nassau County and the state. Instead, the Nassau County came up and addressed the crisis by coming up with a succession plan. She presented us with a succession plan. And her efforts to get supplies for her near and dear first responders but nothing for the black community. Then she proceeded to her daily useless briefings, again provided by Northwell. Okay? Not her health department. They have no clue. They're still missing in action. Okay? This, ladies and gentlemen, are the unfolding of the planned genocide of the black community that lives close to the hub. The hub, as you know, is a long planned development of the area around the Coliseum, with no surprise of anyone. North Hill will be playing a very prominent role. Compliments of the governor and the county executive. The Nassau County Commissioner of Health, well, he and the legislator from the first district, in an interview with Newsday, blamed the severity of the pandemic in Uniondale and Hempstead on the fact that the residents live in densely populated areas and work in areas that expose them to the virus. Okay. In other words, these folks have only themselves to be blamed for the effect of the pandemic on their community. This is a clever shift of shining the light away from the incompetence to blaming the victims. I hope the communities remember this. We can do better. The legislator and the health commissioner surely did not read the recent series of Newsday provided that showed the racism in Nassau County that manifested in the real estate market. I'm sure they didn't read that. But the legislator and his gaslighting colleagues were supposed to hold hearings into this issue, but of course they were reprieved by this pandemic. The hallmark of all dishonest politicians, when faced with an unpleasant truth, is to call for a hearing and then manipulate the outcome. Efforts of the coalition to open the Hempstead General, well, I don't know if you guys remember that the coalition, a small, nonprofit community active organization, had decided to open the Hempstead General Hospital to serve the Uniondale and Hempstead, the very communities that are currently under siege by the coronavirus pandemic, okay? And guess what? This project that's so vital to the community was derailed by the then county executive Swazi, the Democrat, the governor, the health department, and North Hill. This was part of the plan to sterilize Uniondale and Hempstead and have the governor turn the territory over again to North Hill for a neoliberal corporate medical plantation, which has happened, sadly. The Health Divide is another interesting document. Newsday published The Health Divide, a series of articles in 1998. This was a newspaper not known to be friendly to black folks. In that series, which I recommend you to read, blacks were shown in Nassau County, Suffolk, Queens, and the nation to suffer the highest numbers in sickness and death in every disease category in New York State and the nation. Was anything done about this horrible crisis? Heck no. You see, in New York, under these Democrats, black lives do not matter. To the governor, the Democrats, the Republicans, or to anyone. Instead, the governor used the infamous Berger Commission to close at least 174 hospitals in New York City and about 50 on Long Island. Many of these hospitals were in minority communities that depended on them for health care and jobs. Of course, we know what he did. Handed it over to Northell. The argument was that hospitals are costly and not profitable. That was the governor's argument. Since when are hospitals are supposed to be profitable? The existential questions remain. If hospitals are not profitable, how is it that the governor has seen it fit to give North Hill Empire 23 of the state's most precious healthcare facilities to manage for profit? That's an interesting question. How is it that there's been no antitrust investigation from the state or federal government? How is it that New York Attorney General, Ms. Letitia James, has not issued an antitrust investigation into Northwell? How is it that the New York Attorney General allows this denial of health care to black and minority communities to continue? The coronavirus pandemic has shone a spotlight on the structural racism in New York State and the role of the governor and the political system in exacerbating this pandemic. Now the governor, Northwell, and the Nassau County executive are hard at work trying to close the Nassau University Medical Center and turn the site into Hotel Hilton North Hill. This closure, ladies and gentlemen, will effectively cut off health care to the black and minority community hard hit by this pandemic. It will also give North Hill access to the southern corridor. Nassau County Medical Center, or Nassau University Center, Medical Center, is a public benefit corporation serving the residents of Nassau County, especially its uninsured and poor. It is clear from the lack of preparation and public health policy to protect the most vulnerable residents, the governor and the state favor the axis of evil, the neoliberal corporate for-profit, money-driven healthcare plantation system exemplified by Northwell. They do not favor a physician, patient, community-driven system based on caring and compassion. We cannot leave our health and health care, our most precious personal possessions, in the hands of the state. We, the people, must take control or risk another disastrous pandemic and an imperial governor. What could the county executive and the governor have done to alleviate the effects of this pandemic if they really cared? What could they have done? Well, one, they could have had a policy in place to prevent the virus that everybody knew was coming. They could have done that rather than serving at the altar of prophets. They could have had the vision to see the need for hospitals, beds, supplies, protective equipment, masks, ventilators, and staff. They could have had the vision not to close the community-facing hospitals, especially those serving the black, uninsured, poor, and immigrant population. They could have had the vision to establish companies in New York to manufacture masks, protective equipment, ventilators, and other supplies needed, rather than having to purchase them on the white market at exorbitant costs. They could have been honest with the people of New York and admit to failing them by not being prepared rather than blaming the president and others. Stop those daily ego massaging press conferences that are useless. Instead, use the time to go visit the hospitals that are hard hit by the influx of patients and show how much you care by putting on some used masks, protective equipment, and helping the doctors and nurses. While you're at it, take the head of Northwell, your right arm buddy and the health czar. Okay? And you can take the Nassau County executive with you. And be like real leaders. As you claim fighting a war, that's what real leaders do. They go to the front and stand with their soldiers in solidarity. Then you can come and visit the hard-hit black and Hispanic communities in Uniondale and Hempstead to show how much you care. You can discuss the reasons for why the pandemic is so destructive in the black community. Okay? And what are you doing to fix this problem? What are you doing to engage our students with education? What are you doing about mental health? According to Professor Richard Wolff, with all the people that are unemployed in New York State and Nassau County, they can hire teachers for home tutoring on a one-to-one basis. They can hire skilled workers as tutors and teachers. They can hire an army of people as testers and tracers on an ongoing basis. They can hire folks to help encourage mask, hygiene, and physical distancing practices rather than having the police criminally assault folks for not wearing a mask. Hey, it's not that important. We've seen Mikey Pence not wear a mask. We see President Trump not wear a mask. So why are we going to be abusing citizens for not wearing masks? These things have not been proven to work anyway. This is just another waste of time directive to see how many people they will have as being compliant to these silly rules that have no basis in scientific fact. Okay? How about hiring some screeners? We can take those lazy folks from TSA and bring them out to help, screen folks, testing. They're not doing anything now because nobody's traveling. And some people rather deal with the virus than deal with these folks. So bring them out and have them do some useful work for a change. Okay. Hire them to clean offices, public transportation, public spaces on an ongoing basis. Now, it's very interesting. In Italy, in the past, there was a law that came out called the Marcora Law, Marcora law. This law, 4985, is fascinating. It allows redundant workers to use their accumulated unemployment benefits to capitalize a buyout cooperative if they can get 10 other persons to join their venture. It is a bridge from welfare to self-employment. Wouldn't that be great to actually change the paradigm in this country rather than having people work for these big, ridiculous corporations. Get back to the, the roots of America, small businesses. Wouldn't that be great? Something to the Marcora law. Let's take a look at it. Okay? Um, so that's one of the main things that we can do with the unemployment. Get 10 people and we'll give you your unemployment. We'll help you set up a small industry and help you keep it going. And I think people will be more happy. Okay, 400 years of capitalism, and they're tired. They don't want to see this stuff anymore. They want to stay home with their families. They want to work with their families. Okay, you could expand the safety net at this time. That's what we need. Expansion of the safety net, and keep the safety net hospitals open, and expand their services to full service institutions. According to some, the governor and his fellow politicians are using the pandemic as a portal to grab as much executive power as possible. The governor is already acting like an imperial governor. Okay? The antibody testing that he's proposing is a waste of time. It tells you that the patient was exposed but not cured. The person can still be a carrier, and we are seeing this happen. Only the absence of the virus on the patient suggests a cure. In HIV, we do not use antibodies. We use several parameters to determine the scale of improved health. So Northell is advising the governor incorrectly in this and many other areas. According to Dr. Einstein, insanity is doing the same thing over and over again, but expecting a different result. We must therefore change the social and political paradigm we have allowed to continue for 400 years. If we fail to re-engineer and redesign our social society to care for and about people instead of profits, we will be doomed as a society because the next viral pandemic will be mishandled to a degree that will be considered the end of the world as we know it. The choice is ours. Do not elect incompetence, then complain about the terrible job they're doing. Now, these are some of the progressive ideas out there. I don't claim to have a lock on all of these, but these are things that I've heard. These are things I've thought about. These are things that make sense. Okay? And we need to get going and start planning for the post coronavirus period if we can get out of it. Now, for the black community, as I said before, it's very interesting their response. I'm surprised. I look at other communities and I see them banding together, and I see them, even the immigrant community, even the people in detention, I see them banding together and in solidarity with each other and providing rapid response, rapid reaction, rapid response groups to address needs in community. We see Cuba sending doctors to many countries to help. I'm yet to see this kind of solidarity in the black community. Where are all the black baseball players, multimillionaire football players? Where's the Oprahs? Where are all these folks? Where are they? Stop blaming others. Stop blaming Trump and he's got enough problems. When are we going to start doing things for ourselves? Okay? Where are these filthy rich folks? I'm not seeing them. I'm not feeling it, okay? And, this pandemic has caused many other groups to wake up and realize that they're on their own and they're developing their systems. We, on the other hand, are still in that dream state. We refuse to wake up, right? We subscribe to that childlike, dependent, Eurocentric theology and philosophy that looks to an unseen white deity for help. This has kept us and kept them in a dream state of delusion as they search for this deity. And it has prevented them from acting in their own best interests. Blacks are also wedded to the dysfunctional Democratic Party. This party was and continues to be the party of the master and slave, as well as the bedrock of capitalism. Black votes every season for the last and latest white rescuer and are disappointed, getting nothing for their loyalty. As can be seen in the recent primary in South Carolina, they are easily led and told what to do and who to vote for by one of theirs who is in the big house. Blacks will vote against their best interests if told by a white Democrat to do so. Okay? And what hopes there are, they're quickly fading as the virus makes short work of our communities to the delight of our so-called neoliberal cooperative slaveholders who see no reason to provide health care, education, economic opportunities, or political power to this disposable group. The black community must, for once, develop a community-centric self-help policy and provide mutual aid and solidarity to other groups. We have seen that the current capitalist system and its leaders, operators, and sycophants are incapable of providing us with the world we want to live in. Okay? So they're using this virus and they're watching as they're forcing people to return to work in unsafe conditions. But we love you. You can wear your mask 20 times. You don't need protective gear. Why do you? So here we're back to some existential questions. Is this the world we want to live in, black folk? Do we want a democracy where all have a say in the decision making? Do we want leaders? Are these the folks we want as leaders? We need a forensic audit of Nassau County, Northwell, Nassau University Medical Center. We need antitrust investigations into New York State, Northwell, Nassau County, and Nassau University Medical Center. We can do better. We must do better. These are some of the issues we tend to capitalize. It's very difficult to do this in just one setting, but I just didn't want to expand it for too long. But I wanted to give you some of the background because many people are so terrified by the virus and focus on the virus. But what they don't see is what is going on behind the scenes. The plotting and the planning and the deceptiveness and the dishonesty by the people who they go out and give their votes for. We have to wake up and realize that they don't mean us any good. I mean, from 1936 to now, blacks started voting Democrats. They were Republicans at first, and A. Philip Randolph and Walter White encouraged them to become Democrats. The argument at that time was that, well, yeah, you're Republicans, but the Republicans weren't doing anything for you. Well, fast forward 1936 to now, 2020, I dare any black person or white person, for that matter, to show me what whites or what this country, this society has done for black, the Democrats in particular, have done for black folks. Just show me. Please do not tell me Obama, okay? Tell me what they have done for our community, the black community. And then we can have another round of discussions. But to many black people and so on, we tend to not pay attention to history. My grandmother used to say history repeats itself over and over and over. And that's true. You want to know what's going to happen next week? Wait a little bit. The same thing that happened last week. That's how the world is. That's how the world is. The same incompetence that we have now, we're going to have again. The same imperial president we have, we're going to have one again. And he's going to come in a little slightly different outfit, but same person. All right? So until we meet next time, we will attempt to discuss, or we will discuss, what is going on at Nassau University Medical Center. That's what we're going to do. Stay safe.